Western Cape health facilities are bracing themselves for a very busy festive season. The province, which has already entered the fourth wave, is gearing up for an increase in trauma cases. Just last month, health facilities in the province had 14,000 trauma cases. The numbers are expected to spike. eNCA reporter Monique Mortlock sent us this update.
Today, in a briefing by Western Cape Health, we heard that healthcare workers are tired. They've just managed to get through 3 waves of COVID-19, and now we are in a 4th. But Western Cape Health says they are prepared. It's all systems go at the various facilities across the province when it comes to not only trauma cases, but the rising number of COVID-19 infections. To tell us more about this, I'm speaking to Western Cape Health CEO, Dr. Karim. Sir, just give us a breakdown of what it's been looking like so far over the last month when it comes to our emergency centres that are going to play such a crucial role during this festive season.
So fortunately in the Western Cape we have really accurate live real-time data, so we're able to have a sense of what the workload looks like. We had since the 14th of November to today, the 14th of December, 68,500 admissions across our emergency centres in the province. Of the 68,500, 14,000 were trauma-related cases and 54,500 were medical-related cases. So it's been a really significant, busy time, and we obviously expect over the festive season that there will be a significant increase on those numbers as well.
But you said our facilities in the Western Cape, they are prepared, they are ready. We heard from Health MEC Mbombo that only a certain number of staff have taken leave so that there are enough healthcare workers in these facilities.
Yes, and I really want to commend our healthcare staff. So despite being busy with COVID over the last 20 months, over and above that, this is not a period of time when our staff can in fact afford to take leave. Those who are working in the emergency centres, those emergency service personnel who are on the road, and even our forensic pathology service. But over and above that, there's also a range of support staff behind all of those emergency care workers who make sure that we have sufficient oxygen, who make sure that we have sufficient consumables to be able to treat our patients.
And finally, Doctor, in terms of bed capacity, do we have enough in our emergency centres, not only for those trauma cases, but should we see an increase in the number of hospitalizations due to COVID-19?
Yes, we're confident that we have sufficient bed capacity. We also have intermediate care beds that are additional to our service platform. We have 600 beds available to our service platform, and currently, in fact, we only have 39 patients admitted into those beds. So we have additional capacity. Over and above that 600, we can, in fact, bring online another 100 intermediate care beds.
Thank you very much. That was Dr. Karim from Western Cape Health, just giving a breakdown of what those trauma cases have been looking like just for the last month. He says that we could be expecting an increase of at least 15 to 20%. That's an increase on that 14,000 trauma cases that we have been seeing from 14 November to 14 December. But he says Western Cape Health is ready. We have enough bed capacities in our facilities and enough staff to assist. Monique Mortlock, Cape Town.